Hi, it's Paul Sackett, Good News Planet. I'm speaking with Dan Weber. Hi, Dan. How are you?
Great, Paul. Thanks for having me on your show again.
All righty. Dan Weber is the founder of the Association of Mature American Citizens, AMAC, and we're going to learn about the good things that they're doing. We also have Craig Rodriguez also on the line. Hi, Craig. How are you?
I'm doing well. Thanks for having us on today.
Okay, and he's with the CSR Benefits Organization. So this intrigued me, and I imagine it's going to intrigue a lot of 50-plus people and intrigue a lot of doctors. And this is very important because health is wealth in life. How to cover 16 million patients' health care costs for free. Free is always a good word. You're the second largest seniors organization, the Association of Mature American Citizens, and you have a concept to cover these 16 million patients' health care costs for free. So congratulations, Dan, and congratulations on what you guys are doing. Thank you for coming to Good News.
Great.
So tell us the good news.
Okay, the good news is, sometimes, Paul, as we know, the simple answer sometimes is the best. And what we did, we talked to a lot of doctors, and we asked them, about the different trials and tribulations from practicing and so on. As you know, for most doctors, it's a 11 to 12-year ordeal before they really can hang out their own shingle. Yes, some of them are well paid, but they really go through a lot to earn that MD. And anyway, we asked them about all the problems that we have in the healthcare system, and somebody said even after the Affordable Care Act is in place, there's going to be millions of people who are not covered. So wait a minute, would you treat people for free, pro bono, if you would get a tax deduction? And 90-some-odd% said yes, they would. And so we did some research. We found out there's 800,000 licensed medical practitioners in the United States. If each one only took 20 patients pro bono, took care of their health needs for free in a year, 20 times 800,000 is 16 million patients could receive health care for free.
I love the concept, and I actually think it's a wonderful idea, and I agree with it. So how can we move that forward and implement? How do you implement something like that?
Well, actually, we've been visiting the Congress. As I speak, our legislative people are on the Hill right now. I think today they have an appointment with Rubio's office. Last week they had a senatorial appointment ahead of the Democrat committee. So we're working both sides of the aisle. We're getting cooperations from everybody. And what we're trying to do is implement common sense solutions. So let's take this one. One of the things that was brought up, some of the doctors said, well, Dan, if I go along with this, the only problem I see is I could get sued by these patients that I'm treating for nothing. And so we said, well, okay, in New York State, for example, there's a Good Samaritan law that if a doctor stops at an accident scene and treats somebody, he can't be sued. So what we did, we added a provision to our proposal saying, unless the doctor did a deliberate misstep or blatant, then the doctor can't be sued. And then almost 100% of the doctors said they would go along with this. As you know, they have ethical statutes that they follow, that they believe in. They would love to deliver free health care as long as they could afford the rest of the practice. So this is an easy, simple way to do it. And the way it would be handled to make sure there's not fraud and so on, right now Medicaid in New York and other states spends millions of dollars on administration for people who are indigent, who can't pay their bills. So we're saying that Medicaid would contract in each state with a regular insurance company, not for health care, but just for the administration. Basically, all the insurance company would do would be to print ID cards and track the claims. That's it. For that, they would make a small administration fee, which they could piggyback on their already existing coverage, their systems that they have now, and that way it'll work. And everyone we've talked to said it's a great idea. We're having a symposium in Washington on June 9th and 10th, the AMAC Healthcare Symposium. We're getting hundreds of people attending, and that's when we're going to present it to Congress.
That's the day I turn 65, June 9th.
I'll be darned. You sound much younger, so I don't know what you've been doing.
I try not to go to doctors.
There you go, right. That's a good one.
Couldn't they just throw it out here, and I don't know, Craig, maybe you want to talk about this or whatever, couldn't, if they have an insurance policy to take care of those that they do take care of under even insurance, right? They have all I'm not a doctor, but couldn't somebody come up, insurance policy company comes up with insurance policy for those that they take in this manner? And they take that insurance out also, and it's whatever it is. But if they're getting some kind of a tax rebate for their efforts here, then it, could very well be more helpful for them.
Well, are you talking about an insurance policy that the doctors would own to be paid for people they treat uninsured?
Yeah.
Or an insurance policy for the client?
No, to treat, how does it work? Does a doctor has a insurance, right? When you go to a doctor, if you have a malpractice suit, the doctor has insurance to deal with that, right? Overall, in general, right?
Yeah, the doctor would have malpractice insurance, but in a case like this, what we're trying to propose to you is a system that doesn't cost a lot of money. So by allowing the doctor to treat them pro bono and write it off the same as any other business expense that they have. Today if a doctor pays for a phone bill, that's a business expense and it's tax deductible to them. Well, in this way, we're going to allow them to treat a patient and then take it as a tax deduction the same as any other business expense. That doesn't happen today. By doing it that way, we don't have to have the expense involved of an insurance policy and all the things that go along with that. So it's going to be a huge cost savings for everyone.
Okay. You know what, Dan, give me a little background. So unless there are any more specifics you want to add on this, but I'd like to learn about your organization in addition to this specific subject.
Very kind of you, Paul. Yes, we started about 6-7 years ago in New York and in Florida, and now we've grown to 1.3 million members. And we like to see things, if we can, solved with a minimum of government interference and taxation. Not to say we shouldn't have government involvement, but we think I guess what's important to us is the doctor-patient relationship. We don't think that the federal government should overrule that. So what we did was we said, well, can we come up with intelligent solutions to solve some of these problems under the guideline of the federal laws and have its system work well and cost less. That sums it up. And that's what AMAC is really all about. We've got a Social Security proposal to fix Social Security, but I'll save that one for our next show.
All right, that sounds fair enough. And I have an interesting website as well. You're really...
Yes, that website is www.amac.us, amac.us.
Beautiful. Okay, so I'm going to ask one last question for actually each one of you. And I know you're a former military guy, too, so there's a lot of good things you guys are doing. Congratulations. What's good news for each one of you?
What's good news for each one of us?
Yeah,
I've got a son graduating high school in the 21st.
Oh, really? Now you're a little younger than me. I'll say that. Is that right? And
yeah, I sure am.
And but let me ask you a question. Well, how come you're doing what you're doing in this kind of benefits in this world? Because we don't get a chance to talk. Well, what brought you to it?
Well, what I've been trying to do is come up with the best possible solution for people. So we built a practice that's a little different. Instead of worrying about what I get paid or how I make money, we've always tried to focus on the client and doing what's best for people. So I've gotten a lot of satisfaction just out of solving problems for individuals and helping them find the best possible solution for their needs. Great.
And you're the future generation. And Daniel, from being a paper boy in Long Island to what you're doing now, what brought you to that, and what's your good news?
Okay, well, my good news is I've been blessed with 5 children, 15 grandchildren, and 6 great-grandchildren.
Yikes.
And then on top of that, I'm going to just mention a joke that I tell some of my grandchildren. What did the baby computer say to the father computer?
Well, I'll be one of your grandchildren, and what?
Data.
I like it. I'm getting on the horn and calling my kids after their school.
There you go. That's great.
So is that your good news? It sounds like you got a lot of it, Daniel.
Oh, I do. We've been blessed tremendously, and we got to protect our country that gives us so much freedom. And we got to smile, which is one of the things that you and your group is all about, and that's why I salute you.
All right, my friend. Thank you very much. Look forward to continued working with you and your continued success, both of you. Thank you very much for sharing good news with us. Thanks.
Thanks, Paul.
Thank you. Have a great day.
Bye-bye.